Good evening, everyone, and a very, very warm welcome to this webinar. And first of all, a very, very happy Nurses Month. So we all celebrate nurses, we have fun, we have a lot of activities, and we must do that. But it's also important to reflect on the status of nursing. So, where else we can get evidence? It is from the International Council of Nurses. So their documents are pretty long. So what I have done is I have gone through that. I've kind of distilled the essence of that report. Okay. So it's a very good, insight into workforce across the world, and it has reference to low middle income countries, including India. And when you look at the points, you will say, oh, this we already knew. So what it indicates is that, what we are talking is what the world is also talking. So obviously, we need to focus and think of some actions that can mitigate the challenges that we are facing. So let me just share my presentation. Okay, so there we go. Can you see my slide? I'll just confirm.
Yes, ma'am.
Okay, thank you. So once again, happy Nurses Day, and all of you know that this year's theme was our nurses, our future. This has been running for quite some time now, I think already 5, 6 years. Caring for nurses strengthens economies. So I thought we should know what it actually means as per International Council of Nurses. So thank you for being here. So this is the front page of that report. Okay, this is the report that I deep dived into. So let's very quickly, I would love to have some, discussions once we finish. So this is the global insights that they're talking about. This is the global insights. So global insights, no safe staffing skill mix policies. This is all over the world. Violence from patients and co-workers, 86.2%. Salary stagnant or decreasing. Increase in nurses leaving sector. That means more nurses are leaving the healthcare industry altogether. And risk in workforce demand since rise in workforce demand since 2021. It is increasing, so we are running short of nurses. Poor or very poor workforce capacity. So this is kind of all over the world. This is a summary of, and I'm very sure all of us will agree these are also our problems. So we will be looking into deep dive into that. Look at the report that they are giving. So first of all, unmet needs and unacknowledged struggles. I think these two words are very important for us to reflect. I'm very sure all of you who are right now in this webinar, or those who are going to watch it later also, unmet needs and unacknowledged struggles. I think we do talk about our unmet needs and our unacknowledged struggles, probably within our own circles. So the problems that we face probably are not getting mitigated that quickly. The global nursing shortage is worsening. 5.9 million nurses needed now, possibly 30 million by 2030. So all of you know why we need more nurses. The world is getting older, there are newer diagnoses, there are newer treatments, everything is changing. And nurses are facing burnout, attrition, unsafe work conditions. Sorry about that one spell mistake. And then leading to migration. Very much. All of us agree with that, that our nurses definitely, we have a very high rate of migration. And there is also rising incidence of workplace violence, which at least when I was a young nurse, I never heard of, you know, actually workplace violence except for patients who are really, really violent because of their clinical condition. Then, of course, the declining interest in nursing careers among youth. But it's a very interesting finding that after COVID, the admissions to nursing in India has gone up. Then the question is, if they are going up, we are still running short of nurses. Then there are structural issues like poor staffing, underutilized skills. That means the skills which are either not used, it is there but it's not being used, or lack of fair compensation, underutilized. Okay. Reactive and short term fixes. Now, this is a very important statement to reflect on. Reactive short term fixes failing to solve long term workforce problems. All the seniors, including me, I think we do, I think I shared one quote a couple of days ago among the leaders, and everybody agreed. What was that? Lack of time, lack of resources, plus innovation, uh, uh, plus your planning to mitigate that leads to innovation. So at least one leader told, it's an everyday thing, because every day we have new problems and then we innovate something. So mostly in most environments, we find our own quick fixes, but it is not necessarily changing the narrative in the country. Now it is summarizing the return on investment for from caring for nurses. Now the reason why they chose this is to prove that there is a connection between fantastic nurses in a country to the economy of the country. So we will slowly, unravel that mystery. Investing in nurses' well-being yields high returns. So there will be some numbers I'll be giving you. Neglect leads to major cost. We in India, at least, we are not able to put, money onto these problems. Benefits will include lower turnover. And in recent times, there are organizations which are putting a cost to the attrition. Absenteeism and presenteeism. Now, presenteeism is something that I learned now. I never used this word before. What is presenteeism? It's a very interesting, meaning it has got. That means me, I'm a very, very committed nurse. And I used to be like that, when I was working as a critical care nurse. I always felt guilty if I had to take a leave or if I have to take a sick leave. I used to feel guilty. Why? I'll think, oh my God, what will happen to my patients? Then my colleagues will have to take more, patients. So I would rather go. That is called presenteeism. You are not supposed to be on duty, but you still show up. The compulsions can be that you are committed to the profession, or you are shy to ask for leave, or you are seeing what will people think, I'm taking chutti. It could be anything. But the challenge is you are present, but you are not that useful or productive to patient care because you are not up to the mark. Now, healthier nurses will definitely lead to better outcome and better economic growth. I will just put my phone do not disturb so that I don't get disturbed. So, healthier nurses, obviously, all of you will agree that they lead to better patient outcomes. Now, what is the connection of the economic growth? If nurses are available the best nurses are available in the hospital, in the rural areas, in the country, wherever they are required, because they are cared for, they are paid better, they will definitely get involved in the preventive, health of the community. When you do preventive health, overall health of the people will go up and their earning capacity will go up. They will spend less on being sick. So our economy and our GDP will shift for good. So this is a document that is, released by our International Council of Nurses and should also become a place that, the leaders can refer to when you are making your strategy or when you for it. Now, building a healthier future, comprehensive solutions for nurses' well-being agenda. Now, when you look at these, well-being agenda, you would say, oh, we know all this stuff. Then why are we still having problem? Why is that international body is still worried? Invest in resources and equipment. Resources is what they need. Resources can be the right number of people to be available. Ensure safe working conditions. Now, if you talk to nurses one to one, you will actually come across a lot of unsafe situations. But if you run a survey, I think we all kind of like to be on the safer side and we will just go neutral. Whatever is in the middle, we will tend to answer. And this has been my experience for the last few years whenever we were trying to study, because we don't get the candid feedback. And that is the challenge. So I think at least when the survey hits you and we have a responsibility to respond. I do respond to international surveys. Many of you might be responding. I respond to that only because I feel accountable as a nursing professional that I must inform what is not right. So if they ask about country, I will give the feedback about country. Whatever is my experience, I will. The other day, there was another survey that came by where I think a university in UK is trying to understand how do we use social media. So I could have just kept it, but I took the responsibility to respond. Now it's also up to us to think beyond our duty hours. When I know the duty is not easy, it is overwhelming, it is all time consuming, unless and until more of us will start thinking a little bit more broader and trying to think strategy, our improvement is going to be very slow. Things have changed, but it is not changed so much that, we can say that, the miracle has started to happen. No, things are happening. Just give me 1 second. I'm going to admit these people. Okay, you can please put off your video. Thank you. So ICN caring for nurses agenda, invest in resources and equipment and ensure safe working conditions. Now that will have a lot of connotations, whether they are working in ER, ICU, outside, rural area, wherever they are. Build positive organizational cultures. There's a spelling mistake there. Support professional development. Now, all the words that we talked about are very, very familiar. Now, let's look at what was India's specific kind of finding. We kind of distilled it from the report. So, that is about weak mental health and flexible, not having flexible work support. That means this is what the feeling is, that flexibility in work schedule is not so much in India like we have abroad. I was reading one article on virtual nursing. I think in one of the hospitals in US, they have got no, they have 70 nurses who are virtual nurses. I did I think I did a class on virtual nursing. So what they have done, they have got the 70 nurses who are actually virtually available to patients, to admit patients, to discharge patients, to do patient education, even guide the younger nurses. And they use this pool to give flexible duties to those who might have some personal challenge or a family challenge. So they are given that opportunity, and this half of them are work from home. So now in nursing, work from home is never heard of, right? In nursing, but now it is happening. So then that can be one opportunity where you can even give a little different assignment on a rotational basis to say, okay, you can be there, support. I mean, many years ago, when one of my nurse could not walk around for some time because after a road traffic accident had fracture, and the doctor had asked to do sitting work. Now I was thinking, my god, but how do I find a job that is sitting for a nurse? It's not that easy. So it just happened that one of my ward coordinator had just resigned. So that was available. So I gave that opportunity to the nurse after speaking to HR. I said, he's a bright boy. Let him do that job for a couple of months, and we will not hire the coordinator till then, though his salary was more. But these are, again, ad hoc things. They are not really structured things. So now the world is looking at technology to see that, the problems that is being, cited today, maybe they existed early, but they existed in a different manner. The current generation, they experience nursing and the profession in a different way. Only 50% have national nursing strategy. Out of all these, countries, national nursing strategy. And we hope that the National Nursing and, Midwifery Commission will definitely have a very clear nursing strategy for the country. Salaries not matching inflation, real term cuts. I am very sure that many of the nurse leaders from the corporate sector, even I have also experienced the same. Whenever you look at the budget, they want to reduce something. Everybody's eyes will go to the line item of nursing to say, can I cut something? Now for that, it's very important. The nurse leader should have all the numbers in place to say that is it really worth doing the cut. So we really need to do deep dive into the financial aspect of nursing care and the financial loss when something happens because you don't have the right nurse with the patient at the right time. So nurse remuneration is rated poor. 80 percentage of the the countries, including India, they said the nurse remuneration is rated as poor. Okay, poor job absorption for new nurses. Now this is something I would say that is, I don't know. When I was heading hospitals, I didn't have this kind of a problem. I used to take the nurses who have given the exam also in some form, and those who are waiting for registration also in some form. But now there is this challenge where, at least some hospitals, I would say, I really know, they don't take the nurses who have given the exam or they have received the results. They don't take. So one of the young nurses asked me, "Ki, ma'am, if you don't take us, we will not even be this good after 6 months. There will be knowledge decay and skill decay. And then when they join after that much of period of time, we are the ones who complain also that they are not patient ready." So, are we becoming part of the problem, or are we becoming part of the solution? This is something that all nurse leaders need to think, that how do we, our problems are our problems. Obviously, we cannot copy paste the solutions from the developed countries. We need to find our own solutions. So it is for the nurse leaders to think along with the other leaders to see that how do I facilitate these, newer nurses. Many hospitals are taking, and many hospitals are not taking also. Hmm. And the poor job absorption we discuss, increase in nursing applications. Yeah, the demand and the people joining the profession has increased, but that does not mean because they have increased and our solution problems are getting resolved also. One second, my sorry about that. Okay. So we finished that. So the numbers we are already I mentioned, and this the text I already mentioned is the infograph. We have talked about, the nursing shortage, unsafe conditions, burnout and attrition. 86% of nurses face workplace violence. Short-term fixes worsen long-term issues. I think this is what is called strategic thinking, because the solutions that we think about today, we have the responsibility to think whether this will withstand in 5 years and 10 years' time. So quick fixes are good. So what is the return on investment? We know that if nurses are better cared for and their nursing health is better, then you can have lesser absentees. Calculated up to 300 billion gain in productivity. This is across the global study. Better care plus economic growth from retention. All of this leads to this 300 billion gain. Nurses need to be seen as economic drivers, not as just caregivers. Just give me a second. I need to admit a couple of more people. Okay. So whether we are looking at our nurses as economic drivers is the question. There is a bit of awareness creeping in to leaders to prove that how nurses are the economic drivers. Now, but it takes a lot of effort to prove that. Now, imagine if you invest $1 in nurses' well-being, it the returns will be at least dollar double or even more than that, $2 to $4. How will these dollars come? This $1 that we invested in, numbers or their uh, the the planning, whatever is the solution that you have put in, you will get in return $2 or $4, from $2 to $4. That is money. So park this question and we will have a discussion. We'll have a roundtable with the people who are here. Okay. So, what is the strategy that the ICN is talking about? That every country to develop and fund a comprehensive national nursing workforce strategy. Now, we are definitely looking at the National Nursing and Midwifery Commission to set the strategy, improve compensation, staffing norms, and working conditions. Now, with NABH and JCI, a lot of things have improved, but that does not mean the country is improving, because we know that our country is vast and we have many different, you know, tiers of hospitals where, you give different care. So, this is something that every nurse leader have to be aware. How is it that you can offset this? Because there has to be newer ideas when it comes to compensation. We are struggling with lack of quality inputs, but I keep thinking that if I am heading any nursing department today, what will I do differently? So there are some thoughts that come to my head, and those thoughts we will try to discuss in this. Once I finish with this, content, I'm going to open the floor to the nurse leaders sitting here to have a little bit of roundtable discussion to see what do you think that we can do, and how can we advocate for nurses. I got an opportunity to address one of the largest, healthcare system, the main hub in Mangalore. So I was addressing because of the nurses' day. So I could just request the leaders who were there, non-nursing leaders, that please use your political influence to, connect with the political people to ensure that the nurses are at the right place when the discussions on nursing is being done anywhere in the country. It should be nurses there on the table, and it is not always the case. We know that. And implement violence prevention and occupational health policies. Now, we are running a survey on behalf of the Association of Nurse Executives India. So, some of the feedback that I'm getting, that we don't take care of the students when they are coming for their, clinical experience. Now, that's something that we need to seriously think about, because they are our future. They cannot be treated any different. Today they are student, tomorrow they are going to be staff who will come and work with us. How do we promote flexible work options and structured mentorship programs? Many corporate hospitals will say we have preceptor, we have mentor, all good. But when we don't have enough, you know, nurses who are senior enough to become a preceptor or a mentor, because for that you need experience. When you have young nurses who become preceptor and you become mentor, the program has on inherently has got its disadvantages, but I know that we don't have options all the time. So we need to think of plans that can mitigate the same. The problem exists, so the problem cannot be resorted by the usual method. You need to come up with something really novel. Partner in ethical migration and build bilateral workforce agreements. Obviously, it is very important to see that how can we partner to have this ethical migration, because today we have countries who come to our country, talk to the students directly, and just take them soon after their exams are over. So now it is a chicken and egg story, or catch 99 situation, as we say. Nurses definitely bring foreign money, to our land. We know that when they go out, they remit money to homeland. So that is also an economic power for sure. But I always keep wondering, how can the government play a part to ensure that these nurses are also able to work sometime and give back to the country as well? But then always the question remains, the salary is not enough. So that is something that we can mitigate only when the majority of the nurses, they start being the best nurses that they are supposed to be, the best in, the, what you call, the knowledge, the skills, and the attitude. Everything needs to be in place. All of us have excellent nurses, but they are small in number. If that number goes, the percentage goes higher, people will definitely start noticing. Now, why we have far many more number of very highly learned nurse leaders? Why is it that we are not able to shift the needle? Why is it that we are not able to get the, policymakers to listen? And I'm very sure the health secretaries and, the big people of the country, when they go to WHO or anywhere, they will be listening to these things. But somewhere there is a bit of lethargy. And I keep wondering that how do we mitigate that? So these are larger questions, but the most basic question is this picture. So this picture, does it give you any message here? Does it give you any message, this picture? Why is it here? Anyone can reflect on this picture? Hello? Anyone?
Maybe leader is showing a way, a path.
Okay, leader showing a way or a path. And
Vision.
yeah, mission, vision, good, good. All of them are good. My intent was, this is you. So don't wait for so many followers to come behind you, but first responsibility is to transform ourselves. Before you inspire change in others, let the journey of transformation begin within. Why I say that is because each nurse, each leader has to put in their best. Then only the things will start to change. We cannot have, few nurses who are change makers, few leaders who are change makers. That's not going to happen. It has to be a, kind of a movement, where everyone is, talking about the profession and asking that what is it that I can do? Because definitely, I cannot say that the few people who are here, 46 people who join, that itself kind of shows either everybody is well learned, they know what the ICN report is all about, or they think, oh, what is there to go and listen to this? I really don't know. Is it indicating an attitude, a lethargy on our part? Otherwise, for other topics, usually we get a lot of audience. And I'm sure the students are missing because they must be thinking, these are all for leaders to go and understand the report. I think they are right also to some extent because we have the responsibility. So the question is, what can I do? Because at the end of the day, the safety and the quality care that we desire is given by all these nurses, younger ones who are there around in the hospitals. But if we don't seriously strategize the intervention that we discussed today, I'm not very sure that tomorrow is going to be any better than today. So that is the, short understanding. If you look at it, look at the ICN report. It is not rocket science. It's the same problem that we have. The whole world is facing. So it is not that something very new has come up, and they're not saying that we should have more, highly educated nurses. I think it is there, but what is the outcome? We are still struggling with the basics. So now I would definitely request uh, people to, give their opinion, give their thoughts. What is it that you think that we can do? I also happen to be the founder president of Association of Nurse Executives India. So when you give me some feedback, I will also think through the association, is it possible that we can do something? But definitely we'd love to hear from you. What are your thoughts? Do you think what the ICN report, you know, reflected is the same problem that all of us have? Yes, no?
Yes.
Yes, all of us agree. Yes. So,
Yes, yes.
so how do we think? What do you think that we can do? Because my assistant, the artificial intelligence, is also taking notes. So if you give some suggestion, obviously it will get captured, and I will not let go of it. At least we will start to think, how can we do these things? This was the beginning. I thought this is my responsibility to put some, throw some light on the report so that we can also start thinking for our country and for our nurses. Yes, you are free to come on the video and talk, or if you are not comfortable, you can be off the video, but do share your thoughts. That is the biggest challenge. When we have to speak up, we don't speak up.
Ma'am,
Yes.
I just would like to say about this topic that, first and foremost, the value of self by nurses should know, and value of their responsibility
Mm.
and towards the organization or towards the patients. They have to understand and appreciate what they need to do. uh, because the generations I'm getting a very young generation in the work field, or of course the students are young only. They are only looking for the scope and job, but they forget what the profession is. Like the word profession is has got many things, developing knowledge, skill, attitude, everything that we always talk about, but it is not coming into. So that professionalism and passion is somehow need to be uplifted. That is number one. Number two, I also feel many a times the nursing professional need to understand the economics of the country and economics of her contribution to the organization, what she gets in return. Her contribution and return, she should check the balance like this. This is the another thing. The third thing I feel, yeah, already you have said many things. There's something your presentation of the availability in the organization, presentism and absenteeism. So that I have got the leave, I can take the leave. The people is to think like that. But the professional or the artist or anything, they don't think. When they're passionate and professional, they think, what can I do? So what can I contribute? How can I contribute? The job is not the life, but job give us the life. The job give us the beautiful life. So I feel that feelings and passion is need to be enhanced, and by understanding the economy and the contribution to the organization, contribution to the duty, and what something you said, like thinking beyond the box. What until and unless what I can do more than my duty, if I don't have that patience to think, or if I don't care to think about that, yeah, there is no patience and there is no commitment, I'll say. So just coming to the 8 to 4 duty, or 8 to 2 duty shifting, it will not give us our involvement of the heart. So it is very important to have the involved and to think what to do beyond, and to take care of the, as you said, transformation need to come from our own. Yes, we are only complaining that this is not there, that is not there, that is not there. Some of us, we can go back and say that we need to be nurtured well. But who will nurture well? Everybody is doing their own job. I have to nurture well myself. I should know how to create my job and how to create a strategy for my nurses, how to manage their well-being, their regular health checkup, their timely duty of I need to arrange, but I need to also facilitate for improving their capabilities. When the capabilities will improve, automatically their energy will come up, they can give more. So we have to really I always say, nurture the nurses because we are nurturing the humanity. So that you have to understand. It is not a job. It is not just a simply a profession. And I always say, if you are, carrying if you are saving a life, it has been said by someone that you are a hero. If you are saving 100 lives, you are the nurse. But I say, you are an angel. When you can go beyond that and prevent the people from suffering from disease, then only you are an angel. So just like that, I want to say the economy of our country, ma'am, will be improving when we will stop them coming to the hospital, because every pills cost a lot. So we, the nurses, have got the liberty to go to the community, to talk to the people, to when we are caring a patient, whole family, we can educate so that they can prevent many diseases. That's all, ma'am. Thank you so much for giving me so much time.
Okay, thanks, Unmana. I think from your feedback, I was waiting. There are two parts. I am going to just discuss about the leaders because the current generation all over the world, they are the same. Okay, they will look at job. They want to look at quick returns on whatever that they are doing. So general, I mean, Gen Z or next is going to be Gen Alpha. We all have experience. They are not the same. They are not the way that we behave. It's not their fault. That's the way they have been brought up. They have been born into technology, and they have seen the world in a different way. So I think there are two responsibilities here. The major one with the academicians. When they join the college or a school when they're 17 years old, how much of effort is being put in to inculcate the need of a nurse as a professional? What do you mean by that? What is that attitude one need to carry? How much of discussion is happening around that apart from the curriculum? I mean, this is one thought that I always have, that are we giving them enough to think about the attitude that they need to carry when they go to the patient side? That is leadership in academics. Second is the leadership in the organization. The survey that we are running, some of the comments that are coming, they are so revealing because it is an anonymous, survey. So obviously, no names. We don't know from where it is coming, but some statements, saying that, we wish our leader was more kinder. We wish our leader was, asking for our welfare. So this is not a first time that I am hearing this narrative. I have seen leadership where when I interact with them, I get a different picture. But when I happen to interact with their own people, I get a different picture. That means there is a gap between the talk and the walk. Now, that gap is what I am hoping that we have to take the responsibility to bridge, because all of us can talk a lot about nurturing the nurses. So when I do a leadership session, I did ask for the feedback on their immediate supervisors, just to know what should I be training them in a leadership. So I always narrate this story. In one hospital, there was a question that, my in charge makes sure that I take my break during my duty, because when you do a 6 hours or 8 hours, you are entitled for one break, and that break is usually, you know, facilitated by the shift in charge. So it was more than 80 percentage of them had actually written no. There was nobody was facilitating that. And in one paper, those days Google form were not being used, and in one paper one nurse took the effort to write a comment, and I will never forget that. So what that person wrote is, my in charge will never ask whether I had my tea break, but she will never fail to take her tea break. Now that is a very big statement, dear friends. Now, it is always very important to understand from the people that we are saying we are nurturing you, to see that are we really nurturing them, and also understanding the uniqueness of this younger generation. I only know about the younger generation. There are two, three things, the voice that come out from them is that they are not yet that experienced, but they think they are very experienced. So we have to treat them with utmost respect. We have to listen to them for their ideas. They may have fantastic ideas. We have to find a way that in our systems we are able to bring these, frontline young nurses to the main foray of, discussing what needs to be answered. So these are little things that I think there is still a gap, and some organizations are trying to, build structures around this so that, this new generations, their attitude, their desires are also taken care of. And it is right, Udmana, when you say that, we cannot handle them the way our teachers handled us. No way.
True.
And when they come to hospital, then the leaders, they are there today, they also need to know. And we do have a unique problem in many hospitals. The people who are leading them are hardly 2 or 3 years experienced. So they are also not experienced in handling teams. They have not been exposed to the right leadership skills. So we do have problem from everywhere. So all of them cannot be fixed by a quick fix. I'll do this and it will happen. It has to be a strategic approach to say that what is it that we can do. And salary always remains a question mark, especially in the private sector in India. So we'll have to think. I don't know. I was talking about a very, you know, different thought. In when I was in Fortis, I could not implement this, but I did suggest, I think in which forum I was suggesting, no idea. It is about when you receive new nurses, if you take, if you manage them with outcome based compensation, what does it mean? When everyone comes, they have a base level salary. And there, you have preceptors, you have mentors, you put so many people to help them. But if they are not getting help, that means there is a lot of money being wasted. Correct? You are paying to the preceptors, you are paying for the mentors, whoever that you have, employed. If all of them together, if you are not getting the right outcome, then there is something wrong in the input. But if you change that to outcome based compensations, I strongly feel the needle can change slowly. And people, current generation, they want to earn more, they want to be recognized. Maybe that should be the way the human resources should be planned. So let's say that somebody comes in and you have X salary, and you say at the end of 6 months, if you come out at this level, level A, you get this salary. If you come at B level, you get this salary. C, this salary. For 1 year, that is what it is. Next year, again, your increments will be based on inflation, will be taken care of. It will be based on performance. But it's very important to spell out the performance indicators, not to have a long list of 80 things that you're going to measure, which it is only in paper. We definitely cannot measure that. So that is something that we should think of, and you need a lot of courage to make sure that it is implemented, because you have to convince your HR and other leaders that this is something I would definitely like to try out. And I am pretty much convinced with my experience with youngsters, they will rise up to the occasion because they want to earn more for sure, if not anything else. So I'm going to rest now, and Sonali has raised her hand. So yes, Sonali, go ahead.
Ma'am, good evening to you and all. First of all, thank you for having this webinar arranged, ma'am. I think this is something a great thought, because the report is so lengthy that I think many would not read it looking at the length of it. So at least getting a gist of it for many people was very important, and you have done that. Uh, for my suggestions, I think there are a few points what you said are just a moment, ma'am.
Hello. I think we lost Sonali.
Sorry.
Okay.
So I think what you talked about, that the change should begin with oneself. It is There's a tendency to complain about things are not happening, but nobody wants to start that change with them. I think that point is very, very important. The second point, what you said, is we need to have a strategic direction for the country as to how we take nursing forward. I think that's our major point that we have lacked over years. Any being a nursing organization, I do not know whether NNMC comes and whether they would have such strategic plan. I just hope that they would have one. But I think even Annie could take a leadership and create one. We could possibly look at 4 areas. One is about the nursing education, how that can be improved, how transition of the students from student nurses to staff nurses can be better or well mentored. I think those are the biggest aspect, the quality of nursing education. All of us know that there is a voluminous work to be done there. Although we have grown 40% in the last 3 decades in nursing education, I think we have truly gone down on quality. So there is a great need to look at it in nursing education. Coming to the jobs, I think although 30% jobs are in government sector, the largest sector where in India nurses work is the private sector. Whatever jobs exist in government sector, if we keenly look, I mean, in Karnataka, at least we, under the right to information, we have got them to give us status of how many hospitals and nursing colleges in government are well staffed. To your surprise, you will know that, ma'am, uh, I mean, nursing college per se in Karnataka, 80% job vacancies are there. I mean, they have not filled up the positions in government. And I think similar condition exists on the service side also. Most of the appointments of nurses, even in government services today, are made on contract basis. So until and unless we lobby with the government and the policymakers, to first thing is to filling up the existing positions. Second is creation of new jobs. If you take a note, in 2022 there was a document that came out. It was titled as the nursing what is that, public health management policy for management policy for India. And in that document, although 30% of the public health workforce today is nurses, very conveniently there is not even a word that mentions about nurse holding any position in the management cadre for public health. I think only one achievement so far in India we've had is in 2018 we could get nurses in the role of the CHOs, the
Yes.
community health officers, and it has been 6 years that these positions are existing. From our end, nobody has taken a project to evaluate what impact have the nurses made. If we fail to show that impact, I think we'll go unnoticed. That's another area we generally forget, that if we got a position, we must probably be able to show that once we came in those positions, how it made impact on the public health. There's a big, 63% people die in our country with NCDs. And preventive health, you talked about it in your presentation as well, is the biggest area. And I think no one can do better than nurses in preventive health. It's all about information, education, communication, behavioral change, communication. So I think there's a big voluminous opportunity, that potential is there in public health in India for nurses. Somehow we are not taken in, and many of us have not realized that we are not there at all, where we should have been. So that's about, I think, job creation. The third area, when we come to, it's about service delivery. I think most of the service delivery here is happening in private sector. Of course, the government sector is short staffed. Not that the private sector, all of us know, is adequately staffed. The major issues is always when it comes to resources is money. We all know, and the hospitals would not want to raise the nurses' salary, because most hospitals are also having difficulties in, you know, having profitability today, financial viability for themselves. But it's not always the numbers of nurses that need to go high. I think we need to think differently. I don't know about corporate hospitals, but if I look at my hospital and couple of hospitals that I know here, nurses still are engaged at lot of non-nursing activities in hospital. There are a lot of time. In fact, one of my colleague did a study in our own hospital, and it's like almost 50-60% of their time goes in non-nursing activities. So you're paying them a clerk's work that you could get done from somebody else. You're paying a nurse. So if we had less number of nurses, I'm sure we could, if we fix what are the job responsibilities that a nurse will do. We don't see a physiotherapist taking care of any of the ward management activities or any other professional. So I think that we need to really be careful of. And if we have few calibered nurses, we can always lobby for their payments, and probably
I
we will
think,
succeed.
Sonali,
Um,
you hit
mm,
a nail on the head, I would say. You know,
mm,
when I said you need to come up with newer solutions for these problems, not the old ones, you know.
mm,
So
mm.
the skill mix model, you know,
Yeah.
that's what you are talking about, the right skill to the right person, you know.
Yes.
This
Yes.
is something, and now you did a study in your hospital. Now to
Mm.
lobby, one hospital study will not be good enough, right?
Sure.
So if we there's another challenge sitting here. So whenever, at least I know I was part of couple of attempts to do
Mm,
study across multiple corporate hospitals.
mm,
So there is a bit of challenge in sharing anything.
mm,
Because that fear needs to come out. This is reality. I,
mm,
I'm the CNO of a corporate hospital. If I'm very insecure to say
mm.
that these are my challenges, so obviously this is not going to help anyone for that matter, right?
You're right. Mm.
Because I should say, okay, let's get together, because anyway the study will not say that Fortis or Max or Apollo this branch or anything like that.
Absolutely. I
I
think
think
we,
it is
mm,
time for all the leaders to come together and, shed some of those inhibitions
you're
and think
right.
the
Uh,
larger, because we are guilty of that.
yeah, we hesitate, ma'am. I mean, I have also seen at the common forums that people come together, and if I'm from XYZ institution, I would only like to talk about it. Great.
Exactly.
I would like to portray it nice. I would not say that we have issue. It's not about I want to defame that institution or something, but we can always, as leaders, be together and cordially talk about what issues we face and probably discuss, at least brainstorm and see if we can bring out solutions. Than just faking that we all are very happy and we all are doing very great.
I, I think it is very, very correct, because recently I
Mm,
was in another
mm,
webinar in another organization. So there again, it was a academic institution. So the ask was that
mm,
the young nurses should be treated a bit more humane.
mm,
No, they should be treated a bit more in a humane manner. That means we need to be kinder to them. So now these are issues that will never come out, and neither no anybody will accept that we are not
mm.
being kind. We try to
Yeah, I think
say
the
that.
last part, what I was going to say now, ma'am, it's about leadership. I always feel that although we have just, I think, by chance become leaders, because absolutely there is, even though we have some content in the curriculum on leadership, generally what we learn from curriculum is to write examinations.
Mm,
We look upon what models are around her, our teachers, our clinical supervisors, how they behave. We try to imitate that. And I think all of us have learned leadership that way. And whatever we have seen, we are just trying to probably repeat it. So there's proper leadership training also in this country required. Why we are not able to treat our younger ones properly? Basically because we were not treated well. So we feel that ये छोटा है इसको ऐसे मारना पीटना पड़ता है. So
human skills, the managing the humans, it's called the human
yeah,
skills more than the interpersonal skills. The
yeah,
entire bucket is called the human skills. So
yeah.
I think we have a lot to do. And
Mm,
Sonali, thank you. Unmana, thank you for sharing. So I will definitely try to tap into see that, what is it that we can do. I keep wondering, how does this lobbying happen? I think the people who are in good connections, we should try start using those connections. It is very important to see how do we get the ears and the brains of those people who are current. I am very sure there are some secretaries somewhere who are current and who are willing to listen to us. We need to find them and start having those dialogues. I don't know how do we start doing that, because here we all are so much into ourselves that we are all okay to talk in a platform, in a webinar, or in a room. We are all good, but outside we really don't come together to present the professional front together. So I think, Sonali, I'll be reaching out, Unmuna, I'll be reaching out. There are a couple of more people they want to. So we need to get together and have a round table and see that how is it that these, three, four issues that we talked about, how can that be, broken down into some action items. I think we need to rise above this and think for our profession, and that is the call for the day. And my request is also, please, there is a survey that is, being circulated from Association of Nurse Executives India on nurses, well-being, which is called as safety. Some few questions are there under 5 minutes. You can complete the survey. Please help us by doing that so that at least we know what is the condition of our nurses. And every time when I look at the responses, I always feel we are not getting the true picture. I don't know what we are scared of, no idea. Even if it is anonymous, people hesitate from, saying the truth. Only very few will tell the truth. And I take it as a complete truth, people who are having the courage to share the truth. That's what
I, Ma'am, I know the time limitation. Just one thing I wanted to add. I think we all need to learn how to use our challenges and convert them into opportunities. Just an example. During the COVID pandemic, my management asked her to post my students in COVID pandemic, I mean COVID wards. And I said they're all young children. Somehow I'll convince them that we'll pay them some kind of incentives. I had been lobbying that my intern students should get some incentives, or say stipend like medical students get. Unfortunately, INC doesn't have any norm. So I couldn't succeed. And the management also didn't take it. They were just listening, but they took it very lightly only for 10 years. COVID became such a time that they needed their help, and they all of a sudden they agreed that they will pay them that money during COVID. And I converted that into an opportunity after COVID went off. I mean, my students still, all the interns still are paid some 5,000 rupees as a stipend. I think it matters. I feel like our own places, what positive changes for our own people we are able to bring. It might take time, it might take persistence from our end, but I don't think it's impossible, ma'am.
I think, Sonali, that is very, very optimistic note. And with
Mm.
that, I will thank everyone who had come here, and especially thanks to Dr. Unmana and Dr. Sonali for sharing your views. And with that, we have a lot of work to do, and I will keep them alive, and I will be reaching out to see that how we can bring these thoughts, and bring it probably under the umbrella of Annie, and then we will start from there. You will definitely be hearing from me. If anybody else would like to be part of that, please do let me know, because I may not know whose interest is here. We all are here because we care for our profession, and we need to do some things seriously. Just doing webinars, they are good for information, but if we don't do any action after the talk, then we are like everybody else. So let's make a difference. And Sonali, that please do note that the one thing that you told about, making a document of nursing workforce strategy, the way that we think we can do, that is something that, we can take it as a special interest group under Annie. And I would, because we have created ASIG, that means Annie special interest groups. That means special interest groups come together and they do something specific in that domain. So maybe we can create something like that so that uh, interested people can come together and contribute. Yeah, Sonali?
Ma'am,
Yes.
I'm Lakshmi here. I'm interested to do. Hi, ma'am. How are you, ma'am? I'm Lakshmi here.
Yeah, hi, Lakshmi. How are you?
Doing,
Okay,
doing
next.
good, ma'am.
Okay, I'll keep that in mind. So, Sonali, are you game?
Yes, ma'am. I'll be there.
Okay, great. So we have two names, and I'll reach out to a couple of more people who are talking about these around this. So I think at least we should be able to present it. You know, when the
Yes.
commission comes through, we can even present it to the commission to say we did some work on our own,
Excuse
right?
me, ma'am.
Yes.
Good evening, ma'am. Ma'am, this is Bency John. One more suggestion, ma'am.
Yeah.
That the timing of flexibility. Why can't we bring like timings like abroad? Will it be possible for us so that they'll get some leaves extra? They can do their work.
I think, Bensi, we need models which are tested. So I would say
Okay.
that you should test it out and you should be able to talk about it to say that
Okay, ma'am.
this and this is the result I got. You know, I know of one organization which shifted from 6 hours, 12 to 12 hours. So
Okay.
I know it had its own challenges. I think they were successful in going back.
Anyway, I'll talk this about this to our CNO, ma'am. I'm planning to talk this about to our CNO. So how can we bring some changes? Maybe it will become a positive change. We don't know, but anyway, let me try, ma'am.
Yeah, piloting a new idea should not be a challenge because you should always say, I would like to pilot. You know, when you
Okay,
pilot, it's a pilot, you know, and then you show the result. And
okay, ma'am.
if it did not work, then you have your learning why it did not work. Then maybe
Okay,
something else is required because the flexible hours that is possible abroad may not be equally possible in India because our own systems, our security, our conveyance, public conveyance, there are many
yes,
things that
ma'am.
come in the culture at home. So there are a lot of challenges, but nobody will stop you from piloting a newer model. That shouldn't be a problem.
Thank you, ma'am. Thank you, ma'am.
Okay, thank you,
Okay.
Lakshmi. Thank you, Sonali. Thank you, Unvana. Thank you, everybody else who joined us. Thank you so much and take care. And let's not, become pessimistic and let's become optimistic and do something about it, right? So that the
Thank you.
next nursing report at least will, shift little bit towards the positive. Okay, with that great note, thank you everyone and take care. We'll see you another
Thank
time with
you,
another
ma'am.
topic. Bye
Bye,
bye.
ma'am.
Bye,
Yes.
ma'am. Thank you, ma'am.
Mm.
Bye bye.